Well, see, I'm not too much into the becauses here.
Okay.
All I can tell you is that first off, you have to realize that type 2 diabetes is insulin resistance, not that there's a defect in making the insulin, it's the body's utilization. So, first of all, we don't like any of the oral hypoglycemic agents. I saw Julian Whitaker give us a talk on that, and he had a list of all the oral oral glucose diabetic medications, and he had red letters across garbage, you know. And he's able to get most people off of insulin, and I have been able to get most people off of insulin. You put on an absolutely no sugar diet. Now, I think we ought to talk about this a little bit, is that this sugar mania we have in this country is crazy. Half the population is like alcoholics, they're sugarholics. And if these people get off of sugar completely, I mean absolutely completely, no sugar substitutes, no nothing, even stevia. If you're a sugarholic, you don't want to eat stevia, because that's like a wino telling a wino, look, you can't drink wine, but take the cork from the bottle and carry it in your pocket and smell it all day in emergencies, you see. No, these people after 2 or 3 months of absolutely no sugar tests whatsoever will say, what have I been doing all my life? You know, they feel so great without it. So this sugar mania in this country is just totally ridiculous. The other thing you look for is every once in a while there'll be some sort of an allergic reaction to something. Like that one of our colleagues named Philpott did a study where he did glucose tolerance tests on people after testing them with certain foods. He found that sometimes certain food sensitivities would cause a diabetic reaction. So like with everybody with chronic problems, we look for any foods that they might be sensitive to. But in general, we get them off the sugars completely. Then, as far as the nutrients are concerned, we give them the massive doses of vitamin C, zinc, manganese, and chromium, remember, is the glucose tolerance factor, so we give them chromium, and also vanadium has a insulin-like effect on some diabetics, and then the B vitamins and the cod liver oil, and then there's this herb called Silvestri Gemini or something like that that we sometimes give to the diabetics. But now if a person's come in and not on large doses of insulin, you can just start off this big program of whammo, it's just fine. But if a person comes in on high doses of insulin, you've got to initiate this program very slowly, or else they will have a hypoglycemic attack if they're still taking insulin, see. So they have to lower their insulin in order to go on this program.